when you go in a room and you ask people, anybody had a bad experience in healthcare? There's not a single hand that doesn't raise.
Most people don't realize that, like in a lot of businesses, there's art in the upsell, and we don't think about that happening when we go to the doctor's office.
That's incredibly intelligent of the, insurance industry, but I don't want to be a part of that because it's on my back.
I can't just tell you to eat a salad and a steak and cut out processed food. Like, we need to know what your body is going through.
Not only can we help change, the trajectory of your business, but we're changing lives.
Well, hey, everybody, and welcome to another episode of the Next Gen Strategies podcast. We are super excited today to be having another interview episode. And we have two ladies here who have really started doing some innovative things in the healthcare space. And so, as part of our mission with the Next Gen Strategies podcast, we're always trying to bring out, new ideas, new guests, and really kind of challenge convictions to, what people are doing on the business side and even some on the personal side that we'll touch on today. So super excited to have Lisa and Erin on today. So I'll let one of you guys kind of introduce yourselves, talk a little bit about your company, Victress Wellness, and start from there.
Yeah, well, thanks for having us. We're excited about this, and it's great to be able to bring like-minded people together. So Erin and I are sisters, so we do work together. I did found the company in 2017 myself, and then Erin, we're both physical therapists at the time. Erin was still working in home health care. And basically, I was trying to do, as you're saying, more innovative things on the physical therapy side of things, working in a cash pay model, looking more holistic at, how the patient receives care, not just looking one-dimensional at back pain, but how's your diet, how's your stress, more holistic. And I'm telling Erin about all these things that we're doing, and like, this is amazing, and there's this whole revolution in, kind of cash pay and healthcare, and here she is, Erin, you can speak to it, but working with patients in their home that have 20 meds, and this is not okay. And where were we 20 years ago? And that was the exact same thought process that I had working in the hospital and outpatient as a physical therapist. Like, I was seeing patients that are weighing 400 pounds and in their 30s, and just like, this is not acceptable, the route that we're going. And both of us just thinking preventive medicine. Where were we 20 years ago? And then all of that just, snowballed into how are people paying for healthcare and how are companies paying for healthcare. And so we, have teamed up together since then. It's been 7 years now, and been a journey, that's for sure.
Yeah, I think the biggest, pain point that we both were, able to hit on is, from the perspective of trying to be as focused on economics as we could. We weren't trying to, just grab a buck from anybody. But what we realized really quickly is that the insurance business is not aimed for anybody to win, but the insurance business. And so we, as we were just kind of watching things come through, it was like, okay, this doesn't even make sense anymore for us to be in this model. We couldn't quite figure it out yet. We kind of had our idea of like, man, this doesn't make sense. Why is this happening? But then, over time, as we switched over to cash pay and started just kind of learning a little bit more. And that's what we really hope to do today, is just kind of educate everybody on like some of the things that opened our eyes. One of the things that drives me crazy is the idea that, primary care is set up to be a loss leader for hospital systems. And so they enjoy primary care as being like, okay, well, you guys are going to, essentially lose money as, we're paying you your salary. But the idea is that you should be sending us tons of referrals. We should be getting tons of prescriptions out of you. And, we should be getting lots of procedures done, from your end. And those kind of things are what, it's like, as you learn that and it opens your eyes, it's like, dang it, this all makes sense. Why have we not kind of picked up on this sooner? But as we started into those things, I think it really, really opened our eyes.
I think it's tough that most people don't realize that, like in a lot of businesses, there's art in the upsell. And we don't think about that happening when we go to the doctor's office.
That's right.
That's just not something you would consider. And when it's something as important as your health, it's really eye-opening. And I think what's really cool about your business is that the roots of it are in a value set that you had or something you saw that you wanted to see a change in the world. And I think we see a lot of really, successful businesses when the foundation is in value, something that you're seeing that you're trying to fix in the world.
Sure. Yeah, we have no lack in passion, that's for sure.
Yeah. And so, I mean, you touched on it a little bit. So kind of walk us through, I mean, you started the company, it sounds like roughly 7 years ago. So, where did you start it? And, how did you get to where you're at now doing some of the kind of awesome, innovative things that you're doing?
Yeah, I was working in just typical kind of outpatient physical therapy job. You think of getting an ankle sprain or had a knee surgery or things like that. And I was just tired of seeing patients coming in and saying like, I'm depressed or I can't lose weight, or, I'd send them to the doctor and they're like, well, all they can do is give me a prescription, or they don't really know how to talk about nutrition. And so I'm like, we can do this. Like we can do this better. And so I started seeing patients out of my house and my home office and like, okay, God, if this is, what you want to happen, then I'm here, and of course I had my first baby by then. So I was ready to kind of, scale back a little bit and be home more. So that worked out great. And so then from there, I'll never forget it. I had one of my first patients at that time, because I'm starting to get a little bit more into nutrition and such. She came to me and she's like, I can't eat lettuce. Like I'm supposed to eat salads. Like that's healthy for you. I'm trying to lose weight. But like every time I eat lettuce, like my mouth swells up. I can't swallow it. I feel terrible. And I'm like, that's weird. And come to find out, as you guys have probably heard, there tons of people are coming with like these food sensitivities. And there's sometimes no rhyme or reason to what it is or when it happens. But there's this underlying giant, gut issue for a lot of folks. And so just we dove into that, and that led us to functional medicine. So you might have heard of like integrative medicine, functional medicine, really, popular topics. A lot of people are looking for some sort of functional medicine type doctor.
Genetic testing,
yep,
stool testing, microbiome testing, all those kind of things. Like if you listen to any of the bigger, Rogan and Tucker Carlson, I know that we're hearing lots of folks kind of listening to those kind of things and kind of hearing these bigger topics too.
Yeah. So that led us down that path of really taking a deep dive of like, I can't just tell you to eat a salad and some steak and cut out processed food. Like we need to know what your body is going through. And so that led us down functional medicine. And then what happened was, of course, COVID hit, and there was a whole bunch of folks that didn't know where to go, couldn't get in, didn't trust anyone really at that point. And then also, many of these folks that we were seeing just needed good primary care, just needed to better understand what are your vitamin D levels, how are you absorbing, B12, how are you, what are your testosterone levels? These are all very basic things. And so there was a huge gap in our area and of course across the country.
Well, again, it kind of goes back to what I was talking about originally is like, if primary care is a loss leader, if you go to your primary care doctor and you've got some of these in-depth questions, well, they're happy to send you out to an endocrinologist, a cardiologist, whatever ologist. I mean, you kind of name it. And so that's what we kept seeing. It's like we would send them to their primary care doctor, like, hey, we think we need these labs run. And they'd be coming back to us like, well, I got these labs run, but I also got a referral to XYZ specialist. And I don't even know who to trust. Who can I even talk to? And so then that's when we're like, that's it. We have to add primary care. And Lisa knows, our story, my family story is that we had started with direct primary care living in Cincinnati almost 8 years ago now. And so that model was familiar to us. So it's basically a, pay monthly fee that you're paying in order to have access to your provider. There are no per visit fees. It's just, you come when you need it. If there's an emergency, yep, you can call in the middle of the night and they can help direct us. We one time had a little guy with a seizure at midnight, and I'm calling our primary care team so that they can tell us and, kind of help direct Children's Hospital to kind of get us, where do we need to go? But those are the kinds of things that direct primary care is supposed to be doing. So when we decided to add on primary care, it's like, there's no other way. This is how it has to be done, because you're not incentivized in normal mainstream medicine to actually take care of your patient. But in direct primary care, you sure as heck are. People can leave us at any time. They can spend their money wherever they want. And we really want to bring that mindset back to people. It's like the mindset of consumerism, especially in healthcare. Like you get a choice. You can choose. So that became really important to us.
I think it's important to think about. I just never thought about it until I met you two. Is how the health system is incentivized. So it's very easy to kind of look at this and say, okay, in a traditional setting, the financial incentives are to see patients more and in different ways, and especially in settings where the costs can be very high.
Oh, sure.
But then in the DPC model, the incentive for the financial incentive for the DPC business is to see the patient less and get them healthier.
That's
like
right.
Realistically, they're incentivized to get this person well, and that does the best for their business. So it's a really fundamental, if you look at that, where people are incentivized, there's a natural edge to DPC from a healthcare standpoint.
Yeah. And then that's really what got us into working with employers, to be honest, Tyler, is the idea that, okay, we have all these businesses in this area. We're all kind of, especially in 2020, 2021, 2022, everybody's like trying to figure this out. Like, what are we going to be able to do here? Are we going under? Like, how are we doing well? And
Right.
If we're going well, healthcare kind of stabilized a little bit and then rocketed up, so these employers have seen these huge increases on their health insurance. And so we're like, wait a second, we can fix that, because if we can control 85% of your monthly spend, or of your healthcare spend, then that caps that. It's not like there's this, big question mark. So that's really what got us into working with employers then, is being able to see these folks that had these ridiculous increases, and we can say, wait a minute, we can control for that.
Oh, yeah. I was just going to say, I think foundationally right now, we've kind of laid out that, it's just so people understand at an individual health standpoint, Victress Health and Wellness really is kind of this very holistic look at the healthcare of an individual, because you guys have kind of stacked your business up to have all these different functions that can serve somebody for the ailments they have or this or that in a way that's very personalized and doesn't lead to just blindly selecting prescriptions and stuff like that. It's trying to find root causes. And I wanted to lay that foundation down, because I know you guys have gotten, I've heard it, and I know you guys have gotten a ton of positive feedback on an individual level about the care that you guys give. Because I think that's important to understand, because I want to know more about this business side and how this helps employers. But even just fundamentally what you're doing from a healthcare standpoint is a disruptor. And then what you're going to be doing with employers is too.
A little bit, Tyler. I think this is what really separates us, is all of our clinicians, everybody that walks through our door that works for us is trained in a root cause focus. We're not, as healthcare providers, when we go to school, it's our job as physical therapists or nurse practitioners, physicians, we're trained to diagnose, like figure out what this person has and put a name on it. And at Victress, we feel like, okay, that's great. Yes, we can, label things sometimes, but the more important issue is getting to the root cause. Why the heck did this happen? Why is this person having chronic back pain? Why is this person, all of a sudden at 34 have blood pressure through the roof and, cholesterol issues? I don't need to just put a label on that. I need to figure out why the heck that happened. And so that's what we do that kind of sets us apart from an individual. So if you're an individual or if you're an employee that's, brought into our business, you're going to get that same model, that same approach.
And I think the connection is when you talk about the other buzzword term is being predictive, because that's usually what's in the back of the business owner's mind is, well, like, I can't stop the heart attack, or I can't stop the cancers from happening. And we're saying, no, you can. Mm-hmm. As Erin was saying, there's primary care should and capture about 85 to 90% of what somebody's normal medical needs are. But for that 10 to 15%, what we're seeing is, so I'll give you an example. Cancer is another big one. That when your vitamin D levels, your omega-3 levels, and your exercise levels are all optimal, which we can measure those, your cancer risk goes down 63%. That is huge.
Yeah.
And we're not currently testing that unless you explicitly ask your doctor for those things. And they're inexpensive. So those are the types of things that, like, when we talk about being predictive, when we talk about, preventing and lowering costs, there is a tremendous amount of potential there to address those and to bring savings, to a company, and to not just say, well, the big scary things are just going to happen. The other one is, heart attack. We had a gentleman come in with his triglycerides in the 4,000s, and they should be under 100. So when we talk about somebody just walking around with the next heart attack, we should see those numbers trending all the way up to that number. Why are we just allowing it to be there? And what we commonly hear from like HR professionals or the business owner is like, well, they just don't go to the doctor. They won't go to the doctor. And it's like, well, why aren't they going?
Again, root cause focus. Like, why wouldn't somebody go? Well, let's think about that. What kind of experience have they probably had? When you go in a room and you ask people, anybody had a bad experience in healthcare? There's not a single hand that doesn't raise, whether it's you, your kid, your parents, somebody's had a pretty rotten experience. And so that's why these folks aren't wanting to go. So then that's right. What Lisa's saying is like, we get in front of these guys and we say, hey, just try us out. We guarantee you it's going to feel a little different coming to see us. It's not, we're going to give you the options. It's so important to us that we kind of lay that out for people. We think that that's something that really has stunk in healthcare. And the Band-Aid got pulled off of that so widely with COVID, this is what you do and this is how you do it. Instead of like, wait a minute, there should be some choice here. There should be the ability to say, hey, I'm not really sure if I want to, inject myself with this. What could be some alternatives, right? And so those are the things that we're talking with people about all the time, is giving people choice back in healthcare as well.
And I think that's definitely, if I'll put my marketing hat on right now, like I always do, I always try to spin this into every episode. But no, I think that's how just consumers are really trending right now, is folks want to be able to control things, and that consumer choice and being able to educate themselves and not necessarily, be sold to or be prescribed to.
That's right.
Like I think just from a consumer behavior standpoint, like at least on the marketing side, whether it's healthcare, if you're searching to buy a widget online, or if it's another type of service, like folks want to have the ability to seek out multiple options. They want to be able to really understand and educate themselves. And I think that there's a little bit of a level of distrust when, again, healthcare, I'm sure, especially in healthcare and insurance. But so it's how do you overcome that? How do you gain that trust of the person to really make sure that they understand kind of what it is that, they would be potentially, subscribing to, buying, et cetera. And I think that, your model with what you guys are doing with kind of that educational component and like, hey, it doesn't have to be that way. There are good alternatives to what the mainstream, for lack of better words, is really offering.
I think it's important to lay this out too, just because if we're going to I know we want to transition to like how this affects business, because I really want to understand the financial side of it, right? That's my, of
course you do,
finance hat, right? But I think one of the psychological barriers to transitioning to a disruptor in the healthcare field like DPC is that, as a business owner, you're really thinking about like your employees and their feelings about making this change. And they're used to their standard health insurance program they have with their copay or with their high deductible and their HSA and their normal experience. And I think it's really important to lay down the foundation that like what they're doing in terms of care is really changing the game. And and people are having such positive experiences. I think we needed that foundation going into this business discussion.
Yeah.
Yeah.
Absolutely.
I'll tell you how it went down with a group that joined just last month, and the employees are in the room. It's a, very blue collar atmosphere, industry. And basically their HR director stood in front of them and said, hey guys, your insurance is not going up this year. But if we didn't do something different, it was going to cost us $96,000 more. And this is a group of like 24 people, small company. And they said, you all would have been paying more. We're doing something different. Please sit down and listen. And here's why. And I don't think we give our employees enough credit. Like they see it. They see how expensive it is. They're afraid to go. They don't know how much it's going to cost. So you just kind of like Erin is saying, nobody hasn't had a bad experience. And we're saying we're changing all of that. And so what we haven't even touched on is the fact that when you do redo your benefits, you can do it in a way that is a zero deductible plan. And we're like, zero. Let me say that again. Zero deductible.
Right.
You're not paying, to come to our clinic. You're not paying, maybe, some of them have like, you can add on different things like a $500 copay or something for a surgery, but who hasn't paid only $500 to go get, a meniscus repair or something, so the benefits are tremendously richer. And these guys, they could come there and say, you're not paying any more this year. And so then all the guys are just kind of tripping and the business owner steps in and is like, okay, does everybody understand this? And we're like, yeah, absolutely. Like, we're going to go to this hospital and not that one, or this one's better and that one's, it's like everybody, like you're saying, has more choice and they understand it. And it's as simple as that.
So as I'm going to we'll put our business owner hats on.
Yeah.
Right. So let's say, and you just use that example, Lisa. So let's say, I'm an employer, right? I'm the CEO, or I'm the, head of HR, and, I've got 50 employees I'm responsible for. And, some of them might be, blue collar working a factory line. Some of them might be in my office. So, I'm coming up and I'm looking for better alternatives for my employees, right? That's going to help make them more healthy. And it's also going to be, better from a cost perspective. So you come into me and you say, hey, we have this awesome program. Like, so what is that conversation? You touched on a little bit, but what does that conversation look like to somebody like me who is like, I'm all ears. Like, if you have an alternative for what is going on right now, like, what does that conversation typically look like kind of from, when you guys come in and start your initial?
I was going to say, I think it comes down to asking, we ask a couple questions, so we'll kind of jump in and say, okay, are you self-funded? Are you fully funded? What are you doing currently? Where are you at with those kind of things? Because there's really two options. We tell people this all the time. There's two options when you're talking about adding on direct primary care to your benefits options. Option number one is that you can just add us on. We're naturally going to bring those costs down because everything that we do stays outside of your Anthem plan or your UHC plan, right? Okay. So anything that happens at our office, EKGs, all of those, bigger kind of items that can be done in our primary care office, that all stays out of the system, especially if we're doing our job well. And we don't refer out every single time somebody comes in with, a toe boo-boo, they're sending them to the sure. orthopedic doctor, right? So that's how we can kind of give them option number one is like, hey, we can help contain these costs. 85 to 90% of your costs can be contained with us, which means that you shouldn't be getting those ridiculous, insurance hikes. The other option though, is that we switch everything up, and I'll let Lisa kind of explain that a little bit.
Yeah, there's really like only 5 or 6 pieces to an insurance puzzle. Like, if when you get an Anthem plan or a United plan, right, there's like 6 pieces of that puzzle that they're packaging all that together for you. And so what the current problem is that they control each of those points. And I've never heard anybody say upsell, but that's the perfect, analogy of like, hey, you needed a hospital, now you need a prescription. And they are literally upselling each of those things, and they control each of those levers of what happens. So basically, an example is like they said, you can only make 15% profit on the insurance, but you can make whatever the heck you want on prescription. So, that's where they're using it against you. And so what we've done with advisors in the area, and this is happening across the country, we didn't come up with this. Like, we like to think we're pretty smart, but group physicians have been doing this, advisors have been doing this, for decades. It's really caught on in the last like 2 or 3 years, that they've taken those 5 or 6 pieces of the puzzle, and each one of them are now free market. So they are more capitalism, is more driving each of those pieces to where like we have to really do a really good job in primary care. The pharmacy benefit managers are now independent. So whoever's managing your pharmacy benefits have to do it at a cash price and control that cost. And so each of those 6 pieces of the puzzle all come together to make just a way richer plan that obviously, the easy example is like, if you go somewhere and say, oh, I'll just pay cash for my labs, or I'll just pay cash for this MRI, automatically it's like 30% cheaper. Well, boom, that's all you need to do as a business. And so here's your savings. And it's really as simple as that.
Yeah. And I want the audience to understand here as we're talking about this, because there's some terminology here. And if you're not real familiar with how cost in the health insurance market works, when you go out and get a plan, your cost typically is based upon when the plan will come in and try to do some level of like survey of your employees to gauge their health. They'll try to look at like what claims history was. By claims history, how much did each individual basically have in cost of all the different services they had. So if you're an employer and you have a traditional like Anthem plan, every year when you get your renewal, they're looking back at basically everything that they paid for your health insurance versus the premiums that you paid in. And if there's a big delta there, they're going to give you an increase to help cover that. It's just like your car insurance.
The important part of that piece, Tyler, that people do not know is the big delta is most of the time because the insurance company has control of each of those 5-6 pieces.
Yeah.
And can say, oh, shoot, so-and-so had a back surgery and it cost $70,000. When really, when we look at the actual cost of that, they marked it up so that they can charge you that. They only paid $15,000 for it maybe, but you get that markup. It's like $50,000, $55,000, right? And they do that in every piece, in every area. And so that's what's so, mind blowing when you really pull this back. It's like nobody wants to talk about their health benefits. Everybody's like, woo, I only have to do it once a year. I don't want to talk about it anymore. But it's like, as a business owner, how can you not see that and say, wow, that's incredibly intelligent of the, insurance industry, but I don't want to be a part of that because it's on my back that this keeps happening over and over and over again.
I think that's where we're talking about incentives, right? How is the program incentivized to make money for that business?
Absolutely.
And in that traditional model, the incentive is to drive up the claims so that there's more bottom line for the insurance carrier. Whereas in the model that you're suggesting, really the incentive is to drive costs down and get people healthy.
Yes, absolutely. Here's the problem. If you're under 100-person company, maybe lucky if you're 50, 75 somewhere, they won't even show you that data. So you can't even sit there and figure it out. Oh, sorry, you're too small.
You're too small.
We can't show you that data unless you really ask. And I just, sat down with somebody a couple months ago, kind of in the 100, 125 range, something like that. And he's like, this is the first time I've ever done this. Like nobody's sat down with me. And so then it always kind of begs the question, because a lot of folks will just say, oh, our broker takes care of that. They said there's nothing else we can do. And most of the time they don't know that there's something else they can do.
Mm-hmm. Yeah, we like to give the brokers the benefit of the doubt a lot of times is that they really don't know. They're trained. It's similar to, a physician, right? So we kind of put everybody out there, pretty much on the same, level in that, brokers, physicians, it's not like they're all out to get you. It's that most of the time they were brought up and trained by the insurance industry, physicians brought up and trained by the insurance and the big pharma industry, right? So we have to be really careful with that because it's not like we're saying you're all bad people. Yeah. It's just that, okay, wait a minute, can we take a little deeper dive here? And that's where we found some brokers in the area. We're, obviously in Shelby County here. And there's some brokers in the area that are really willing to kind of do this and pull the lid off. Because here's the other thing that stinks for the brokers. They're capped on what they're making every year now too, So when we can kind of show them that, it's like, okay, this makes a lot of sense.
And so, it sounds like obviously the choice and being able to kind of peel back the onion, like obviously can lead to more immediate cost savings, but then even longer term, maybe you guys speak a little bit to some of the productivity side of it of like, if what happens to employers, like there's obviously the straight bottom line cost of healthcare and premiums and those things. What happens when, you have employees who are proactive about their healthcare? How does that then impact the output for the company just in the work and the everyday?
Oh man. So this is what we feel like, okay, in our little corner of the world, do we have the ability to like make a huge difference? And we feel so hopeful. This is what like drives us and gets us up every single day of the week, because it's like, yes, not only can we help change, the trajectory of your business, but we're changing lives, like as they come into us, as they're starting with us, they're starting with us in their 20s and their 30s, that's such a difference than when we get somebody on 25, 30 medications. Lisa underestimated. I would often see people in their homes in their, 70s and 80s on 30 medications. That was not an uncommon thing. And so it's like, if we can reverse all of that, just like what Lisa was saying, initially, it's like, if we can start from the beginning and say, wait a minute, your blood pressure is starting to trend up. Let's figure out why that's happening, instead of Okay, now you're on a blood pressure medicine. Now it's affecting your kidneys. We better change it and add a different one. And we better add this. And now you're kind of depressed because you don't really feel that well. And now now. Do you know what I mean? So that's really what it's like, this is where we get, all like starry eyed and stuff because we get so excited about that.
Which is so cool, right? Like that's part of why, we love being able to kind of share these stories of folks who are doing these innovative things. And especially in your case, I mean, health, it doesn't matter what we talk about from a marketing standpoint, an accounting standpoint, a legal, IT, whatever. Like if your health is not there and, you're not feeling good every day when you get up and you don't have the stress of potentially, the large bills or the side effects of prescriptions. And, obviously we're not saying that all these things are bad and unneeded, but to mitigate, right, a little bit of the dependency on certain things, like I think that it can really, really make a huge impact on, a lot of different things. So it's so cool. That's why I was so excited about this. But it's so cool to hear the stories of kind of how this is going.
Well, we had the pleasure of dropping in when you guys had an open house. And it was interesting because I think a couple people stood up and told some stories about their healthcare journey with you guys. And that was really touching too. Just hearing the sincerity some of the patients had about like how dramatically their lives changed by getting like this root cause type of, health care. Just speaking from somebody where I have a lot of family members, I got a lot of family history of heart issues and diabetes and all of that, and being hopeful that this form of medicine is going to make lives a lot better down the road for people that are in their 20s and 30s is really kind of heartwarming and exciting to think about.
Yeah. When, you don't want to discount the guys that are coming to us in their 50s and 60s, right? Because they're coming to us, at such a different point, but they're coming to us and they know they're not feeling well. They know they're not feeling great, and sometimes you just think, oh, well, this is the reality. We've kind of been fed this lie that like, as we age up, you're just not going to move as much and you're just going to have to be on medicines and, things like that. And, people can still make that choice. I think it was really important that you said that. I think it was Grant and maybe Tyler that, you can always make that choice. Again, that's our job is to say to you, here's your choices. We can either start to work on some strategies that will help to lower that blood pressure, a little bit naturally, or we can try some supplements, or we can try prescription, or, you know what I mean? So it's like this huge, it's like every step of the way we can make that choice. Most of the people that come to us in this area don't want to be on prescriptions, but there are some that are like, listen, I've been on it for 10 years. I'm not changing. We always give our dad as an example for that. He's like, I can't change my blood pressure medicine. I've been on this for years, So, that does happen. And we're really happy to kind of meet people where they are. Again, all of our practitioners are trained in that way in order to be able to provide, both avenues.
Have you guys been able to come across any data or just any thoughts overall in what you're seeing in terms of cost savings for businesses who look to go this route? I know it's all dependent upon the health of their employees, but I don't know if you had much on that.
Yeah, there's quite a bit of data, and the Millman group actually has done a study as well. And, so Society of Actuaries has actually done this. And this is why we're able to go to underwriting and say, hey, direct primary care, the model of primary care that we use, this monthly membership model, has been shown to produce X amount of savings or X amount of ROI. And so then underwriting can take that into account, and now your risk is even less. And so that happens on one front. A lot of the other studies kind of go in between like 2,000 to 2,500 in savings per employee per year. So that's a good kind of benchmark that we try to hit in that 2,000 range. The company that I brought up that saved the 96,000, they were in $4,000 range.
Yeah.
So it's possible, by all means. So those are usually kind of the benchmarks that we're trying to hit.
Yeah. And again, this is the cool part is that we're not the only ones doing this. There are, 8,000 some other, direct primary cares throughout the country. I think that was 2022 when we pulled that data. So I'm sure there's way more than 8,000 at this point. But the idea is that, the studies have been done. It's not just us, sitting up here and telling these amazing stories. It's like, no, this is happening nationwide, right? And that's the other thing that's really cool too, is we'll get a lot of companies say, well, you guys are great, but we're a nationwide business, like no problem. Let's help you, connect. Or we're a statewide business. Great. No problem. Let's help you connect. Let's find some other great direct primary cares that we can, team up with, for your employees too. So, another really cool part of that.
Yeah. And to, as we kind of wrap up here, I think to that point, that was going to be one of my questions is, we have listeners from multiple different states who have tuned into this podcast. And so, where, for folks that maybe are in, Missouri, Kentucky,
Sure,
New York,
yeah.
and they're interested in learning more, but they obviously maybe can't work directly with you guys since you're here in the Miami Valley in Ohio. Where can they reach out? Where should they go? Is it to your contact information? You can help them out, or where would you recommend, we send some of those folks?
Yeah. So a couple of things. We are looking to expand to add, locations throughout definitely Ohio, and then, throughout the surrounding regions. So whenever somebody has, about 500 lives that they're able to kind of team up with, or maybe it's them and another business or two, we can definitely look at seeing whether it would be appropriate for us to kind of, drop a location there. We don't enjoy teaming up and like just being in an employer's, building. We find that employees often in that situation are just hesitant. They're going to know about me. They don't realize even that, you're seeing all the data, through their insurance anyway, but that's an option too. And then the other option is something called DPC, Direct Primary Care, DPC Frontier. And there's a mapper there that you can look at and just see, okay, who's local to me. So if you're a smaller business and, it doesn't seem like it would be appropriate for us to, add a location where you are, then that can be an option too.
Awesome. And we will for sure make sure that we link to, obviously the Victress website. We'll make sure we have links to folks maybe have questions, or they might want to reach out to the both of you.
Absolutely.
And
we're happy to connect you too. Because there's brokers nationwide as well that we really feel comfortable working with as well. So if that's something that you're interested in as well. So the direct primary care is one side of it. And then the other side of it, like we said, is, finding a great broker that can kind of put all those pieces of the puzzle together, like Lisa was talking about.
Yeah, and I wanted that. If you want to learn more, don't hesitate to reach out to Lisa and Erin, because when they spoke about that, like that's kind of part of your business model, because I kind of know you guys a little bit, right?
Yeah.
If you are an employer and you have 50 lives, it might be hard for you to find something like this, but we've done this in episodes too. A lot of times you have referral partners or just business associates you deal with. If there's any capacity where if you are all like-minded in this, if that can add up to 500 lives, it's something to where Victress may be able to drop a clinic in that area. And I know you guys already have people kind of on almost wait lists in different areas. So you wouldn't be surprised. It could be in your area that they already have some interest. So it could get them over to the next level to get that clinic going.
Well, even, in surrounding communities, like we are looking at expanding, north, south, in our local area. There's an area about 60 miles south of us is the city of Dayton, Ohio. And there are several direct primary cares located in Dayton, but there's nothing, they're all south or north, and there's nothing like central in Dayton. And so that's why we're looking at, pinpointing one in, kind of in the middle of Dayton, so that we can kind of reach those employers that, their employees live there. That's where they're living, or they're living really close to that. They're not all in Centerville or, Springboro or, south like that. So, so that's kind of important. That's why it's just, something to think about, and happy to talk people through that. Lisa is really amazing at, kind of walking people through those first steps. And, she's training me to learn how to do that as well.
Yeah, I can't say enough about the advisors that we have worked with and currently work with, because wow, they are doing amazing things. And one of the groups is CNA Benefits out of Dublin, Ohio, and they have groups across the country that they work with. But the training that a lot of these brokers are going under is called Health Rosetta, And they're pretty big on LinkedIn and their website, and they have tons of case studies. And they do have another mapper there where you can find somebody that's, if you prefer somebody local, as well too.
So I was going to add, also feel free to reach out to them just to pick their brain on this stuff, because we just do not have enough time to do an episode. And some of the conversations that we have had about like just the knowledge you guys have of the healthcare industry and how it works and how it's almost set up to like, how do I want to say it?
And sometimes it's incentivizing certain things, and it should be incentivizing.
Yeah,
others.
it's just so eye-opening, and I don't think the average person knows. And you guys just have so much a wealth of knowledge of what's going on in that industry and how you're trying to change it. And it's just one of those things that once I understood it, it really changed my just whole thought process of healthcare moving forward.
Yeah, and so to kind of wrap it up. First off, thank you guys again for hopping on and joining us today. I think this is, from a knowledge standpoint, this has got to be one of our better episodes in terms of just good information that folks can take back, whether it's from a personal standpoint, or if you are one of those businesses, employers and leaders, to just really challenge those conventional thoughts and open up your brains to what else is out there, and know that there are some alternatives, and there are great people like Lisa and Erin who are working to try to improve the lives of people everywhere. And so we thank you guys very much for joining us. And like I said, we'll link to everything. We'll make sure that all the links that we talked about a little bit, people can find you easily online on YouTube, etc. And until next episode.
Yeah.
Thank you.
Thanks, guys.
Thanks again for joining us today on the Next Gen Strategies podcast.
Be sure to follow the show on Apple Podcasts, Spotify, or wherever you get your podcasts.
And if you really enjoyed it, give us a share on any of your favorite social media channels.
And don't forget to leave us a review.